Welcome back, viewers. We are happy and we are glad that you're joining us this evening. This is the second part. We have our guest tonight, who is Eunice Masharia, reproductive health expert. And before we went to the show, we were discussing about, these abnormal bleeding patterns or some of the menstrual issues that come along, with ladies and with women. We've already looked at what is normal. Now we are looking at what are some of the abnormal patterns. And Dr. before you continue, we have just looked at, and you just told us that heavy flow is a big problem. It has its own issues, and describe what that means. We've also looked at, minimal amounts, because that's also abnormal, and in between, bleeding in the month. And these have basically causes and factors that bring these issues to come along. And just moving from where we were, talking about rapport and patience, I think that's a good place. That's a good point to to just move on with that. So, can you tell us more about these abnormal bleeding patterns? Are there others bleeding patterns that probably would want us to understand? Yes.
Okay, yes. The other pattern that we'll talk about is when you have periods that are coming. They are cyclic, yes.
Okay.
But the cycles are too short.
All right, so periods are there and they are coming, using your words, but the cycles are too short.
They are too short.
So they are less than the 21 days.
They are less than 21 days.
All right, so a cycle of a fewer days. All
yes.
right.
So you find it becoming like a pattern. After every 2 days, you get bleeding for 3.
Oh.
2 weeks, sorry.
2 weeks.
2 weeks, you get a bleeding that lasts for 3 days. Then another 2 weeks, you get another bleeding that lasts for 3 days.
For 3 days.
So you can see it is truly a menstrual cycle.
Okay.
Because the cycle here is very important. So it is cyclic.
It's cyclic. There's some
but
regularity.
It has a very short
duration.
Duration.
Yes, in between.
Yes, that also would be checked out, and it can be there primarily. And when it's there primarily, you may find it is associated with an ovulatory cycle. This person is not ovulating. Sometimes it becomes of much concern at the point where this person is interested with conception. Yes, yes, those are some of the one of the other pattern. And the other pattern that you may find, again, you may find
just before, sorry for interrupting you.
Yes, okay.
We are saying that you have a regular cycle. This cycle is cyclic, so it's predictable.
Yes.
And probably you give an example of every 2 weeks, and that lasts for like 3 days.
Yes.
Now, and said it could also be lacking ovulation because of this minimal days.
Yes.
How would you differentiate that with the one we call the intermenstrual bleeding?
So with the intermenstrual bleeding,
yes,
it's likely to take a different pattern. Like you find how your periods come. Maybe if they come and they last for 3 days,
yes,
they came, they lasted for 3 days, and they were over.
Yes.
Then in between, either you're having a spotting,
okay,
or you get there's a day,
okay,
you have even to use a pad. Then maybe it may always be there,
yes,
maybe for a while,
yes,
but you find there's a day again that comes, which is now within your cycle. Remember, you have understood your cycle.
Yes, you already understood your cycle. We came from there, yes.
Yeah, we came from there.
Yes.
Then you find where you're expecting your periods, they will still come with their normal patterns.
Okay.
But in between, you're still getting other
you're still getting other cycles, so to say.
Other bleedings.
Other bleedings.
Yes.
All right.
Yes.
And the causation for these two, varies.
Yes.
The causation varies.
Yes.
The effects is going to vary because, like you're saying, even in terms of the output, even in terms of the amount of flow, and all that's going to vary. And you're saying some of these, like the intermenstrual, would have a bigger duration in between, and therefore it's not as having much discomfort as the other, which is very small cycles. So, I think that's important for our viewers to understand, because again, we are saying that with this kind of bleeding, there's an effect. I know we'll be coming into that or some of this effect, but there's an effect about these small cycles and this intermenstrual bleeding.
Yes.
All right. Just proceed on.
Yeah, we can also have prolonged cycles.
Prolonged cycles. So the opposite can also be
also
true.
can
Yes.
also happen.
And it also occurs.
It also occurs where you have periods that comes after 35 days, longer than 35 days.
Longer than that 5 days.
Those are the people who tell you my periods can go for 2 months, then they come.
Oh my. Right.
I'd say 3 months, then they come. They come. That is longer.
That's a longer duration.
Yeah,
yes.
which also is associated with anovulation. Like they do not ovulate in most cases, yeah? When you have such kind of patterns, which becomes a challenge when they have need for reproduction.
Okay.
Yes.
So this term when they don't ovulate, anovulatory? Why is it important? I know, we're talking about these patterns, but why is it important that really ovulation should take place? Because probably that's one of the questions our viewers are asking. Why ovulate then? What is the importance? What if I don't ovulate? What is the big issue?
The big issue is,
yes.
And remember, there are times even we remove that ovulation,
Okay.
because when we do family plannings, sometimes what we eliminate is
the ovulation.
The ovulation.
Is ovulation
yes.
big.
So maybe what I need to say is, what is this ovulation?
What is this ovulation?
An ovulation is the maturation
yes.
of the egg.
Yes.
Because with every cycle, there is the maturation of an egg. Many eggs try to mature, but there is one that becomes dominant and eventually mature.
Okay.
And it is released during ovulation.
During ovulation.
During that position.
Yes.
And I think that would be very important for me to mention again some of the signs of ovulation.
Right.
Because some people have had some signs of ovulation that can be disturbing.
That can actually be disturbing.
Yes.
Kind of before you mention that, our viewers, welcome so much. If you're just joining us, this is Elevate TV Health Up Show. We're discussing menstrual health, and we have our guest tonight, and I think things are moving on well. And if you just joined us, kindly don't touch that dial. Don't move, don't migrate. This is going to be of very great importance to us. So when you're saying, Dr. when you're saying about ovulation, yes, and the signs,
yes,
because you say some of them will lack ovulation, so it's a concern.
Yes.
And when you also told us the normal, you also told us there's a place of ovulation phase. I think all this is in tandem and is in line, which is very good.
Yes.
So yes, kind of what are these signs of ovulation?
The signs of ovulation, one, and does not everybody, they don't become very apparent to everybody.
Yes.
And when you don't see them, it does not mean you do not ovulate.
Disclaimer.
Disclaimer.
All right.
Yes.
I mean, so we take one by one, but
Yes,
that's
yes.
good.
So if you don't observe those signs,
yes,
that does not necessarily means that you do not ovulate.
You do not ovulate.
Yes. But again, those who get ovulation that also come with some significant symptoms, it is good for them to understand what is happening is physiological and it is ovulation.
And it's ovulation.
It is ovulation. And the most significant is when the egg is released from the ovaries to come to the fallopian tubes at that point of ovulation when it matures.
Yes.
It can cause some irritation.
All right.
On the abdomen.
Okay.
And there are some people who are going to experience that. The pain that comes lasts for some hours, can even go to 12 hours in severe case. And it's self-limiting. It will, if you don't take a medication, it will still go on its own. By the time you're trying to think, what is this? Do I take medication? The pain, how is it? It can disappear on its own. So those, and then someone might observe, it happens every month.
Every month. Again.
Sometimes on the right, sometimes on the left.
Patterns.
It has some patterns. So then that person can be able to be reassured that this is due to ovulation.
Due to ovulation.
Yes. So that's what some people can get disturbed when they're ovulating.
Yes.
The other sign is that there's a vaginal mucus that comes. And the most important characteristic, you find it is much more, because that time the body is preparing for fertilization.
All right.
So it's preparing to receive a sperm.
Yes.
So you find that the mucus become thin to allow for the swimming of the sperm in case it is there.
In case it is there.
In case it is there. So your body prepares for that. In the process, you produce more mucus, but it is a clear mucus that is important to note. Yes, that it's a clear color. I'm a turbid, you know that.
Yes, it's going to be colorless.
Colorless.
It doesn't have. It doesn't have a specific color.
And then it has. It can stretch.
It can stretch.
Yes, it becomes stretchy. When you touch, it stretches. Then someone can be reassured. This is just ovulation. I'm not worried, because some people come to hospital with that concern. But I always say, what you are not sure of, come to hospital.
Yes.
Don't even ask your friends. Sometimes they will mislead you.
Or don't Google.
Dr. Google.
Dr. Google is Dr. Google can sometimes mislead us also.
No, Dr. Google is a very good person.
Oh, all right.
Yes, Dr. Google is a very good person, because they're going to inform what you cannot inform.
I should not put them in that much.
Not that much. But I always tell my clients, differentiate Dr. Google and your doctor.
And your doctor, yes.
Yes, because Dr. Google does not address your need.
Yes.
Does not address your symptom.
Yes.
They address the disease. Not you. Dr. Google does not examine you.
Okay.
And Dr. Google does not listen to you. So once you have gotten your information,
Dr. Google is a very calm, relaxed, at least doctor.
Yes. So it's always good to learn from Dr. Google.
All right.
But don't manage yourself with Dr. Google.
Yes.
And I don't know whether you have observed, because Dr. Google leave our patients more worried than they are supposed to.
Absolutely.
Because once they read Dr. Google and they say, your periods could be just because of family planning.
Yes.
It could be just because of weather.
Yes.
It has affected your pattern.
Traveling.
Your stress issues could affect your menstruation.
Yes.
Then they're going to find down there something that says it could be cancer.
Right.
What do you think they carry home?
Cancer.
Cancer.
Yes. Because that's a big elephant.
The big elephant.
That's the big thing,
yes. So Dr. Google is good, but don't rely on Dr. Google per se.
All right.
Also be you.
Yes.
Yes. Don't be a disease. Be a person.
Be a person.
Yes.
Seek health advice.
Yes.
Seek some consult.
Yes.
So basically what we are saying is, because we came from this ovulation and an ovulatory cycles,
Yes.
from this bleeding pattern, we are basically saying that this ovulation is very important for conception to take place.
Yes.
And that's what we are concerned when you say an ovulatory cycles,
Yes.
ovulation, or there is ovulation. And when you look at these abnormal bleeding patterns, that's why we have to address them. We have to have a health provider, addressing these particular problems, because later on, we don't want to have issues to do with infertility or inability to conceive and to have children, which is also another, medical issue, as it were, amongst it being, social and emotional and in diverse dimensions.
Yes.
Right. So let's get back to this. We're saying we have prolonged, periods, which
Yes.
could have an ovulatory cycles.
Yes.
So, something about it you won't tell us?
So the most important thing is,
Sure.
if that has not been a pattern, you would also want to know, why is this happening?
Yes.
Important to mention is that when menopause is coming in,
Okay.
when menopause is setting in,
So
we start getting abnormal patterns.
Abnormal patterns. We talked about menarche.
Yes.
I am tempted to believe that menopause has some relationship
Yeah,
or sister or cousin or something with menopause.
Yes.
So when menopause begins setting in, please you can define that menopause, then proceed on with the second. Yes.
Yes. So the menopause is when there is now cessation of reproductive age.
All right.
The ovarian reserve.
Yes, the ovarian reserve.
Yes, because the ovaries, they are the ones that hold the eggs or the
Yes.
ovum.
Yes.
When the ovarian reserve is getting exhausted, remember, girls are born with all their eggs.
Okay. That's a huge one.
That's a huge one.
That's
yes.
a huge
You
one.
are born with all of them.
That's a big truth.
So
God
at some
given
point-
us these things from the word go.
Yes.
He has risen from the word go.
Yes, he has given us,
that's-
because not for you,
that's-
you keep reproducing.
All right.
But for the for the ladies, for the ladies, they get a point of exhaustion.
Okay.
So once the ovarian reserve is exhausted, there's no more production of hormones, the estrogen and the progesterone.
And the progesterone, yes.
Yes, which was stimulating the hypothalamus that we were talking about for the other
Yes,
hormones that
yes.
produce about.
That,
So you
yes.
find there will be cessation of the menstruation.
Menstruation.
So the menstruation does not last forever.
Okay.
It ceases.
It is at some point. The way it
Yes,
started
it
at some
ceases at some
point,
point,
it also
yes.
ceases at some point.
It ceases at
during
some
life.
point, yes, which dates from the age of 45 to 55.
Okay.
Yeah, that's on average.
That's on average,
That's on average. Yes. So if you have or if you go to the menopause,
Yes.
you find there are some changes in some patterns.
In some patterns, yes,
yes,
that's what-
which
yes.
sometimes can account for what we are saying. Periods, they start getting delayed.
Yes.
You get maybe 2 months or 1
Yes,
month, they don't come. The other month they come. So those are some of the factors that you look at. So the age is always important. Other environmental factors are always very important.
Yes.
Yes. And if you allow me to mention this again, because we have mentioned the menopause.
All right. Okay.
Allow me to go to the next pattern, because I will not want us to miss out on this.
To miss out on that. Just before
Yes.
you go there, Daktari, I think our viewers, this is getting really interesting here. It's getting really informative, and I hope and I trust that you're still together with us. Kindly use that number that's going down on your screen. Send us an SMS, bring a question, bring an input. We probably can be able to handle that, not within the show, but probably out after the show, and we are glad that you continue to watch us. On our social media platforms, we have the YouTube, we have FB Live. Kindly share, right? If you have something good that you are eating, kindly invite your neighbor and other people to come and share with you. So keep it elevate. This is Health Up Show, and we are glad that you're continuing on with us. Kindly, we left it at a very hot point, and you said
Yes.
you don't want our viewer to miss on this.
Oh,
What
please,
is it
yes.
that you don't want them to miss on? Kindly.
Because we can have what you call postmenopausal bleeding.
Postmenopausal bleeding.
Yes.
Post-menopausal bleeding.
Yes.
Right.
Yes. Postmenopausal bleeding
Yes.
is so significant
Yes.
because we think about it as cancer until we prove it otherwise.
Wow. Think about it as cancer until
It's
you
proved otherwise.
Cessation happened, but then they are bleeding again.
They start bleeding again.
And probably as we go along with other postmenopausal bleeding, because these are abnormal bleeding patterns, for how long should we say someone has entered or has gotten into menopause? So that now we say this is postmenopausal.
If you have cessation of menstruation for more than 6 months.
For more than 6 months.
Yeah, consecutively.
Consecutively, like 1, 2,
for more than
3
6
years.
months.
Yes.
And you're not pregnant.
And you're not pregnant. Disclaimer. You're not pregnant.
And you're not pregnant.
All right. So
Yes.
that's postmenopausal bleeding,
Yes.
considered as cancer.
Yes.
Unless proven otherwise.
However, let me say also this.
Please do.
That not all are due to cancers.
Okay.
But what you'd worry most is cancer.
Cancer.
Yes. So, and why I'm bringing it here is because most of the patients will come and what they tell us is period zangu zilipotea lakini zinakuja.
Okay.
For them, most of them, our grandparents, they don't consider it as bleeding.
Okay.
They still think it is menses because the only thing they knew was coming out was menstruation.
Okay.
So when they start bleeding, they say, I'm getting my periods. And they had stopped.
And they had stopped.
And she's 70 years.
All right.
So sometimes they try to keep quiet about it.
Okay.
So when we visit our parents and, you know, so when you hear them mention anything close to that, they may not tell you everything because they're shy.
And that's why
But get them to somewhere to be seen.
Get them somewhere to be seen.
Yes.
Don't just Google again to Mr. Google. Get them somewhere to be seen. Let the history be taken so that we can be able to get an examination to be done, investigations as necessary, and so that we can be able to make a proper diagnosis.
Yes.
All right. So it's not just a break, then we are getting back to it. No. It is a problem.
It's a problem.
Okay.
And it should be evaluated.
It should be evaluated.
Yes.
All right.
Yes.
All right. I think that's very useful. Our viewers, we interacting with you, and I believe you're interacting also with us as we just continue on with this. It's getting informative and better as we move along. Now, having talked about that, any other bleeding pattern that's abnormal that you think, or that's just it?
I will not just it because again,
okay.
Now we are talking about not necessarily abnormal menstruation, but now abnormal bleeding.
Bleeding.
Yes.
Okay.
Because reproductive health entails sexual health.
Okay. Reproductive health
entails sexual health.
Okay.
And you should not have sexual intercourse and bleed.
You should not have sexual intercourse and bleed. Okay.
So if you have sexual intercourse that is followed by bleeding,
all right,
then it becomes a concern.
It becomes a concern.
Yes.
So don't associate it to be, part of the menstrual flow or part of the menstrual bleeding.
Yes.
That's a different problem altogether.
It will be a different problem altogether, and you should not ignore.
Okay.
Yes.
All
yes. Right. So that's abnormal bleeding that is of major concern.
Of major concern. It should also be evaluated. Now, Dr. I think maybe we can also give a word. Are there some, because sometimes, and I think some of them we've mentioned them along the way, as we just, during our discussion. But are there some myths, or some misunderstandings, from your, from a general practice, are there some understandings and some myths which are basically wrong about, menstrual hygiene, menstrual flow, menstrual health, abnormal or, bleeding, that we probably need to have our viewers, understand? Maybe just one or two if such that we would want to address.
Okay. The myths, I may not say much, but I know in some community,
all right, and
maybe in some religious circle,
okay,
where it is assumed it is unholy.
All right.
There are some places you are allowed to take up some activities when you're having your menstruations.
Yes.
And some of the effects is that it can be embarrassing.
Yes.
Because if I've been doing this particular activity,
yes,
and today I'm not allowed to do that particular activity,
yes,
because I'm having my menstruation,
yes,
which reason do I give for not participating?
All right.
Does it mean I have to let my my coworker or whoever I'm with in this particular activity
Yes.
always know when I'm menstruating.
Exactly.
You know, that is a bit humiliating
It's a bit
for her.
humiliating.
It can be humiliating.
And this matter is personal. Yes.
And
Yes.
it is
Yes.
personal.
Yes.
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 Those are some of the things that we have observed.
Okay.
Yes.
So basically what you're saying, this being normal, this being expected at some point in age, no one should be denied an opportunity to probably, work, go to church, if I use that one, or places of worship in that sense, or even go to school. There should be no denial. This should be taken as long as the necessary measures. I know we're just going to talk brief about menstrual hygiene, but as long as those necessary measures are put in place, there should not be a denial.
Yes, there should be.
And this should be considered to be normal.
Yes.
Right.
Yes.
Now, having said that, I think we're just coming almost towards the close of this show or this particular program, and I believe our viewers, you're enjoying this. Now, when you talk about menstrual hygiene, we can broaden it up a little bit, because we have also seen there are other types of bleeding, as it were.
Yeah.
But what would be the part of health education or the message you would want to get our viewers to understand? We are saying no discrimination. We are saying let's understand. We're saying this is normal. It is started at a particular point. It will end at a particular point. How should we carry ourselves? When these things is happening, when this is happening, menstrual flow is going on. What are some of the things in menstrual hygiene, public health importances?
Yeah. What is, I would say, of it comes also with health aspects.
Okay.
And also environmental aspects.
Yes.
If I look at it from the environmental factors,
Yes.
In terms of you should also be mindful, in as much as it is physiological.
Okay.
You should be mindful of the people who are around you.
Okay.
So if you know you are nearing your menstruations,
Yes.
do you want to walk without a pad in your bag?
Maybe not.
Maybe not.
Yes.
Okay?
Yes.
Yes.
All right.
And you need to secure yourself and secure your other people near you, because you don't want, again, you go to a bus and you wake up again and
All right.
you leave the seat soiled.
Yes.
It will be very embarrassing.
Yes.
Yet it's something that you'd have taken care of.
Yes.
If it doesn't catch you suddenly.
Yes.
So when it comes to menstrual cycle,
Sure.
then we should be prepared for it and be armed for it.
Yes.
There are some people who get even warning signs. They also have premenstrual syndromes.
Yes.
There are some who don't get even any
No
warning
warning
signs.
signs, yes.
But again, if you know your cycle,
You can keep track.
you can keep track.
Keep track on it. Yes.
Yes, and you'll be able to anticipate.
Yes.
And that can help you and also spare the others who are near you.
Yes.
The other thing that would say is, how do you dispose?
How do you dispose?
Yes.
That's a big question. How
Yes.
do you dispose this?
Yeah.
And are these parts we're talking about disposable?
Yes.
And are they biodegradable? Can they decompose in that sense?
Yes.
So how do you decompose? Because you're saying they contain blood.
They contain blood.
And this blood, is, we'll consider it to be infectious,
Yeah.
because we don't know the source, we don't know what is in there. So we consider it to be infectious.
Yes.
So kindly, yes, how do we dispose the parts? Because you don't want to find them on the road, you don't want to find them on the garbage side,
Yes.
somewhere on the estate, we don't want those kind of things. So how do we dispose so that we can take care of the community? Because our viewers, one of the things that we also need to understand is we have a community to secure, we have generations to secure, we have our brothers and sisters, we have children. So how do we do that? And this is why this is very important, because this is within our reach. This is something we can be able to do. So how do we dispose that in a respectable, in a way that doesn't pose a risk?
Yes.
Yes, kindly.
Yeah, I think it would depend with individuals,
Okay.
environments, because we all have different environments. And if I'm in an urban setup,
Yes.
if I'm in a rural setup, I may have a pin latrine
Okay.
where I will dispose
All right.
comfortably. If I'm in a urban setup, I may not have a pin latrine.
Yes, the access will not be there. Yes.
Yes, but still I need to dispose.
Dispose, yes.
Yes. So if you're in maybe in an office and all that,
Yes.
we would encourage everyone who has an office
Yes.
and a female toilet.
Wow.
Can it be put
Yes.
the pad
Yes.
bin?
Yes.
Because
yes.
that pad bin, it makes it easy, because if I come to the toilet, I change my pad, where do I dispose it?
Exactly.
Let me go
Okay.
back with it in the office. And remember, the blood will smell.
Yeah.
Yeah, so it is important.
Yes.
When we have our offices, we create that.
Yes.
The other thing is, if you're at home again,
Yes.
if I have to dispose maybe to a bin, because
Yes.
and circumstances may still dictate.
Yes.
How do I secure it?
How do you secure it before throwing
Before I throw it to that bin?
Yes.
How do I secure it?
Yes.
Yes, most of them will come with a paper and all that. Some people will use cotton wool, unless you have no other ways, because again, cotton wool can easily introduce infections.
Yes.
But whatever you have used,
Yes.
can it be tied well before it is disposed? You become also mindful about other people within your environment.
Within your environment, yes.
Yes,
Right.
yes.
Right.
In as much as it's physiological, we also have to take responsibilities.
And then probably you also want to say that we also need to take care of our bodies in terms of, cleaning and, having a bath,
Yes, that's what I was saying now again.
Yes.
Besides the environmental
Yes,
aspect,
yes.
there's some people who have ended up with infections
Yes.
during their menstruations
Yes.
because of improper
Yes.
hygiene.
The improper hygiene.
Yes.
Yes.
I would encourage to use the right materials as much as possible.
Yes.
We know there are some communities, some areas, not
Yes.
community per se, but some where we have poverty and low economic status.
Socioeconomic status.
Yes, where getting a pad is difficult, and that's why we are encouraging about rolling out, supporting school-going children with
Yes.
pads,
Yes.
even as we educate them.
Yeah.
So we are asking for that support,
Yes.
but also don't overstay with a pad.
Don't overstay with the pad.
Yes.
We don't want it to be a source of disease.
It will, yes, it's going to introduce infections,
Yes.
and we start dealing with other things.
Other problems.
Because when you get that infection, it goes to the uterus, it goes to the fallopian tubes.
Right. Thank you, Daktari. I think it's a parting shot. What is this one message? Because we just want to come close of this show.
Yes.
Our viewers, unfortunately, we have to close this at that particular point, but we're looking forward, to have our guest next time. But what would be this parting shot and one message you'd want to leave our viewers with? Because this has been a very encouraging, very interactive show and all that. And just give one point that you want to leave our viewers with. That's good.
Yes, then my viewers, what I would encourage us as men is that menstrual cycle is a physiological process, but you also have to observe the environmental factors. When you have abnormal patterns, as we have mentioned, do not shy from coming to hospital.
Yes.
And again, don't also wait for too long to come, because sometimes we observe our symptoms for too long, especially those which come and disappear.
Okay.
Sometimes we take too long.
We take too long.
Yes, and maybe there's something that is going on and you only come to later diagnosis. And because women, we are very good in preaching gospels and listening to each other when you go for chama or wherever. Kindly, you are not her,
All right.
be you.
Be you.
Yes, she can tell you her experience.
Which is
She can tell you her diagnosis, what she got, but it may not be necessarily what you have.
what you have in your
Yes, seek your own health advice.
and
Yes.
get the right
Yes.
instruction.
Yes.
Right. Thank you so much, Daktari Eunice. We are glad that you joined us and that you have spent your time with us. Our viewers, we coming to a close of this. Thank you so much for interacting with us. Kindly, that SMS or that number that is there, you can send us your SMS. Just in case you missed the show, kindly check it up on FB Live and on YouTube, and we look forward that this is going to be of great benefit to you. Keep it elevated, don't touch that dial. This is where we look about wellness and all your health, and that is, we are concerned about it. Thank you and God bless you. See you next time. Bye.